Hi, we're Salura Health, and our project focuses on redesigning the cervical tenaculum. Here's our team. And what is a tenaculum? A tenaculum is used to stabilize the cervix during procedures like IUD insertions and biopsies. But traditional tenacula use sharp hooked tips that puncture tissue, and up to 89% of women report moderate to severe pain when being used. This pain leads to bleeding, anxiety, and even avoidance of routine care, especially since the device is often used before anesthesia. This affects everybody: patients who experience pain, providers who must use a traumatic tool, and administrators balancing safety, cost, and patient satisfaction.
For our design, it will differ from current market options that instead of having sharp end hooks, it will have a saddle-shaped tips, so it will be more broad and have a rounded geometry that will distribute pressure and minimize tissue puncturing and tearing. Another feature of our design is going to be a drug-eluting coating pad. This will be removable, so it's completely optional for clinics to purchase this. It will have pads at the very end of the tenaculum loaded with a topical anesthetic that is most likely going to be lidocaine that will further help reduce patient discomfort. The rest of the design is going to be very similar to current market options, as it will be easier for clinics to adopt the design into their practice, and it will keep the device at similar price points to current market options. These are models that display specific parameters for our design, with the top left showing spring force, the top right displaying lidocaine diffusion, the bottom left measuring contact pressure of the device against the cervix, and the last one showing tissue conformity using Young's modulus.
Now we're going to look into market and sector identifications. So our primary market segment is women's health and gynecological instruments, which both feature a large market size. The women's health device market is predicted to increase over $40 billion by 2034, with gynecological devices seeing a gain of $12 billion by that same year. Our value proposition centers on improving the experience and efficiency of cervical procedures for every stakeholder involved. For patients, we deliver a gentler experience with less pain, less fear, leading to less avoidance of needed care. For healthcare providers, we preserve full clinical control while significantly reducing tissue trauma and bleeding. And for healthcare administrators, we offer lower per procedure costs and seamless adoption within existing clinical standards.
To implement this device, we are focusing on a straightforward regulatory pathway, low-cost manufacturing, and adoption that fits naturally into clinical workflows. This device qualifies as a Class 2 510K using the traditional metal tenaculum as the predicate device. This makes approval much more predictable while still offering a clear improvement in patient comfort. We selected materials that already work with FDA-approved production lines, and durability will be confirmed through strength testing and repeated autoclave cycles to ensure it holds up through sterilization. Adoption is expected to start with OBGYNs and women's health clinics, and the workflow stays exactly the same. The clamp motion and instrument feel are familiar, so no retraining for physicians is needed. Thank you.